And as a
Okay.
nurse, I come to this with a very unique perspective because I understand the anatomy, physiology, endocrinology. I mean, I understand the disease, the pathology. There are a ton of sex therapists around, and I'm friends with many of them. They would
Mm-hmm.
take a different approach, for example, to lack of
Mm.
desire. They may start
Mm-hmm.
looking for partner issues, which might exist, right?
Sure.
Well,
Yeah.
let's look at something like inability to have an orgasm, right? Extremely common in
Mm-hmm.
women, like women without cancer, who rely on penetrative intercourse alone to achieve an
Mm-hmm.
orgasm. Something like only 20% of women that will actually achieve that. I would
Mm-hmm.
approach it very differently, saying, okay, so what treatment have you had? What nerve damage is there? What is the status of your pelvic floor? Because all of these contribute to lack of orgasm. Yes, if there's
Mm.
pre-existing problems, I might approach the solution very similar to a sex therapist, keeping in mind that there may be internal damage that we can't change, scarring, for
Mm.
example, right? That can't be changed. But that forms
Hmm.
context of that person's experience, and that's important.
Thank you for distinguishing that. The sex therapists that don't have the background that you have, I guess the idea is that they are aware when it might be helpful to pull someone like you in
Yeah,
to the
yeah,
fold,
absolutely.
right?